This new year means there is no longer a Medicare donut hole for prescription medicines. Instead, there are now 3 phases of drug coverage: annual deductible phase, initial coverage phase, and the catastrophic phase. We've got our 2 insurance experts with us to explain what you need to know about Medicare. Catherine Sevier from AARP, Steve Edmunds from Alliance Insurance. All right, so first and foremost, let's explain the different parts of Medicare.
Medicare has 4 parts, A, B, C, and D. Part A is the one that we all get that doesn't cost us anymore when we go on to Medicare, and it pays for hospital care. It's your inpatient piece of care and ultimately some rehab if you have an event that you need to go to a rehab hospital. Part B is the part that we use the most, that we pay a premium for on an ongoing basis when we're Medicare recipients. It is doctor's visits. It is things like radiology, x-rays, labs, physical therapy, all the things that you need as an outpatient to get yourself, to keep yourself well and to keep your physical exams going and all of that. Part C is an opportunity that you have to choose what kind of Medicare program you want. There's what we call original Medicare, which is Part A and Part B, and it has a lot of flexibility in it. You can pick your own doctor as long as he's a Medicare eligible doctor and your health system. Part C is a bundled plan that you would call Medicare Advantage, is usually what we hear it is called. And it puts all of those pieces together and pays, and you don't have to pay for them as separate entities. It does require, however, that you stay in the network that you've chosen, or you will pay very highly if you move outside of the network. And then Part D is our prescription drug plans. And you have to have one of those, or you will pay a penalty when you try to go back and enroll in one. And prescription drugs are very expensive. So when you sign up for Medicare, you either go to a regular Medicare program and get a prescription drug plan, or you can go to Medicare Advantage and your prescription drugs are covered as part of a Medicare Advantage plan.
Okay, gotcha. All right, so then let's talk about the Part D, the drug coverage that has the big changes. So let's go through what each of those phases means.
Okay, so you're going to have 3 stages in 2025 under the Medicare prescription drug program. Stage 1 is going to be called the deductible stage. And we all know what deductibles mean. No matter what kind of insurance that you have to meet deductibles. So with this type of Medicare coverage now, with the prescription drug plans, a lot of the plans are going to have a deductible. So you would have to meet that deductible before you start paying your smaller copays. Now, on almost every plan that I've seen, the deductible will only apply to your brand name medications. So generic drugs, you'll still be able just to pay the simple copays right off the bat. So you do have to meet the deductible in this stage. And then once you have met your deductible, then you go to stage 2, and that is called the initial coverage phase. During that phase, that's the really simple part of your drug coverage. You just simply go to your drugstore, or mail order brings you your drugs, and you're just paying your copay, just like always, just like most everybody is always used to doing. So you just continue to pay your copays all throughout the year. And then the last phase is going to be called the catastrophic coverage phase. That's phase 3. And it will come in once your out of pocket expenses on medications have totaled at least $2,000 for the calendar year. Now, understand what makes up that $2,000. That's the premium that you're paying for the drug plan itself. It's the deductible that you're paying when you meet the deductible in stage 2, plus it's your copays that you're paying all throughout the year to get up to that point. So when all of that totals $2,000, you hit the catastrophic phase. And at that point, it's good news. Your copays are 0. So your medicines are free the rest of the calendar year after that.
All right, a complicated topic that it was explained well. All right, let's talk about this, Steve. Let's talk about the drug payment plan that is brand new for this year.
Yes, this is something that's brand new, and we're all trying to get acquainted with it at this point. But here's what we know about it so far. The Center for Medicare Services has approved a premium payment plan to activate something like this, and this would be for something like with folks that are taking a lot of medications. Okay, if you're taking 2 or 3 generic medications, you're not going to be interested in this. But if you're taking a lot of medications, and that total is going to get up to around probably the $2,000 mark, like the catastrophic coverage comes in, you can actually have that divided out by 12 months for the calendar year. So instead of paying big deductibles and big premiums right at the start of the year where it just hits you really, really hard, that can now be spread out evenly throughout the 12 months of the year where you have a consistent and, really just a very systematic premium payment for that all throughout the year. Now, to do that, you will need to get in touch with your insurance carrier or your insurance company, and that is set up through your actual prescription drug plan. Those are the folks that will work on that and set those type of things up for you. But we're excited about that because that's going to be a really good benefit for folks, and it's going to keep you from being hit heavily in January, basically.
Well, and I think a lot of people already know that they're going to hit that $2,000 deductible because they've been on medication for a while.
Right. Yeah. Agreed.
All right. Well, thank you both for joining us. You can find this information in the Who Wants to Know section of our website.